Those are some of the headlines. This is Democracy Now!, democracynow.org, The War and Peace Report. I'm Amy Goodman.
And I'm Juan Gonzalez. Welcome to all of our listeners and viewers around the country and around the world. In a dramatic scene yesterday on Capitol Hill, several Democrats walked out of a congressional hearing on the Obama administration's contraception rule. They took action after the committee chair blocked testimony from a female witness who supports the mandate. The rule would require health insurance plans, including those provided by Catholic-affiliated hospitals and universities, to offer free birth control methods. Before walking out, Democratic Representative Carol Maloney of New York criticized the panel at the hearing, which was exclusively male.
What I want to know is, where are the women? When I look at this panel, I don't see one single woman representing the tens of millions of women across the country who want and need insurance coverage for basic preventive health care services, including family planning. Where are the women?
In response to Representative Maloney, committee chair Republican Darrell Issa of California explained why the female witness was disqualified.
The minority chose the witness we had not found to be appropriate or qualified. Now, appropriate and qualified is a decision I have to make. I asked our staff, what is her background, what has she done? They did the usual that we do when we're not provided the 3 days and the forms that go with it. They did a Google search. They looked and found that she was, in fact, and is, a college student who appears to have become energized over this issue.
D.C. Congresswoman Eleanor Holmes Norton expressed outrage at the chair for his decision.
One thing, Mr. Chairman, we've been denied the right to have a witness. I want to have the right to make a parliamentary inquiry.
More about the issue, we're going to Washington, where we are joined by D.C. Congressmember Eleanor Holmes Norton, who also walked out of the congressional hearing in protest. And we're joined by Sandra Flukes, the female witness who was not allowed to testify at the all-male hearing on Capitol Hill yesterday. The first panel was all-male. Sandra's a third-year law student at Georgetown University Law Center and past president of Georgetown Law Students for Reproductive Justice. Georgetown is a Catholic university whose health plan does not cover contraception. We welcome you both to Democracy Now! And Sandra, why don't we begin with you, as you weren't heard yesterday on Capitol Hill. If you had been able to testify, tell us what you would have said.
Well, I was there really to talk about the voices of the women whose lives have been affected by this policy, who have been affected financially, emotionally, and medically. And what I wanted the members of Congress to hear and the public to hear is what a difference this policy could make to their lives. I wanted to talk about how birth control is not accessible widely, that clinics are being defunded and are closing, and it's not easy and it's incredibly expensive. It's up to $100 a month. That's $3,000 over law school, and it's a financial burden for 40% of our students at Georgetown. And I especially wanted to tell the particular stories of some friends of mine, actually close friends, who have medical needs that require birth control for reasons other than preventing pregnancy. For example, one of them, it's just a tragedy. She lost her ovary. It had to be surgically removed because a massive cyst the size of a tennis ball grew on it because she didn't have access to contraception to prevent that. She has polycystic ovarian syndrome, and as a result of that, the doctors are very concerned that she's going into early menopause at the age of 32. And of course this will cause complications for her ever trying to conceive a child, and puts her at increased risk for heart disease, osteoporosis, and cancer.
But how would contraception have helped her prevented that?
Well, for many of these types of medical conditions like endometriosis, polycystic ovarian syndrome, many other conditions, doctors regularly prescribe contraception to prevent growth of things like cysts or fibroids, and that's widely medically accepted and is the most appropriate and effective form of treatment.
And Representative Eleanor Holmes Norton, the decision of the majority, the Republican majority, not to hear from the witnesses that the minority had put forth. How frequently does this happen? And what was the buildup before the hearing? Were you surprised completely by the decision at the last moment?
Well, we were very surprised. I've been in Congress more than 20 years. And the context of this, of course, is that Republicans had lost this controversy to a compromise that the administration worked out between religious institutions on the one hand and insurers and women on the other hand. So the committee simply reframed the issue in order to exploit the religious side of the issue. Well, this was an issue that had two sides. It had a religious liberty side, and it had the side of the women who needed contraceptives. And really a quite unprecedented move. The committee vetoed our witness, the young woman you just heard from, stacked their side with extra witnesses, and we were supposed to sit there and act like good little members of Congress. I have never seen a minority witness excluded. The majority doesn't have the right to, quote, qualify who your minority witness is. We only are entitled to one. But you remember, they could have had their 10 anyway, and we have had only one. As it was, we had none. So women were the silent majority who weren't heard at the table, and the table really was about the discussion of women's reproductive health.
So you walked out of the hearing. Describe the scene yesterday, Congressman Eleanor Holmes Norton.
Well, I want you to know, somebody had to do it. The Democrats didn't walk out. Even Carol Maloney came back. That we needed to have somebody there to, of course, respond from our side. But I was so outraged by the heavy-handed, autocratic, undemocratic treatment of the majority, the Republican majority to the minority, that's us, that I thought that a statement had to be made. And I thought that a statement had to be made because this is an issue with two very important sides. The administration came forward with a compromise that satisfied most Americans. Why anybody would want to work up a religious controversy, bringing in 5 men from various religious denominations with no women at the table, says everything about the kind of polarization that the Republicans are still intent upon stirring up on the Hill. Remember, the economy is beginning to take hold. So they seem to have reverted to their old saw, the social issues. There was no reason otherwise, since a compromise had been achieved, to even air this issue in a full committee hearing the next week.
Congressmember, could you explain what the compromise, the Obama compromise rule is?
It is one of the best win-win compromises I've seen since I've been in Congress. The compromise, at the bottom line, allows religious institutions, and remember, these are universities and hospitals that hold themselves out to the public and receive, if they're a hospital, more than half of their funds from the public, from the federal government. Yet these religiously affiliated institutions do not have to touch or pay one dime for contraceptives. On the other hand, the insurers must in fact provide contraceptives through contraceptive insurance. How is this going to happen? It turns out, and this is the untold story here, that it costs insurers more to withhold contraceptive insurance. And if you think about it, the reason is that childbirth costs a great deal more than contraception, and childbirth and its complications cause a great deal more. So the administration was not only able to work out a compromise that satisfied women whose reproductive health should not be trampled especially by an accommodation to religion, and yet religion must be accommodated and was accommodated, and there's no extra cost to women. I don't know how you could have had a better compromise than that, or why anybody would wish, having in our country gotten to a compromise on a very fragile issue, and wanted to stir that pot again, except for blatantly political reasons.
And Sandra Flukes, the position of the Republican majority that you weren't qualified to testify on this issue. You're at Georgetown, a Catholic university. You've been leading the fight around this issue at your school. Could you talk about your efforts on this issue?
Absolutely, and I had to say I thank you for playing the clip of Congressman Issa explaining that I was not an appropriate witness. I can't think whose voices would be more appropriate than the women who are affected by this policy. And I really want to echo what Congressman Murphy said, which is, if this was not a hearing about women's health, then let's have a hearing about women's health. Let's talk about it. So in terms of my efforts that led to this point, I've been part of a group of students who have been working on this for several years. And in fact, there have been students working on it for decades at Georgetown and at universities all over the country. Many religious universities have struggled in this way. And we've just done everything we can. We've surveyed our students about the impact it has on them, had extensive meetings with the administration. We've considered whether or not there are state laws that could protect us. And at this point, you know, we've been met with a deaf ear. And that's why we're so grateful for these regulations and for this compromise, because we think that it really achieves our most important goal, which was to make this important basic health care accessible to women to prevent the medical tragedies that I talked about, like my friend.
Congressmember Eleanor Holmes Norton, in an interview yesterday on MSNBC, the top donor to Rick Santorum's super PAC, Foster Freeze, said contraception doesn't have to be costly. Well, he said because women can use aspirin for birth control. Asked if he thought Santorum's position on contraception would hurt his viability in a general election. This is what he said.
I get such a chuckle when these things come out. Here we have millions of our fellow Americans unemployed. We have jihadist camps being set up in Latin America, which Rick has been warning about, and people seem to be so preoccupied with sex. I think it says something about our culture. We maybe need a massive therapy session so we can concentrate on what the real issues are. And this contraceptive thing, my gosh, it's such inexpensive. You know, back in my days, they used bare aspirin for contraceptives. The gals put it between their knees, and it wasn't that costly.
Excuse me, I'm just trying to catch my breath from that, Mr. Freeze, frankly.
That was Andrea Mitchell responding to Foster Freeze. Congressmember Eleanor Holmes Norton, your response?
Well, it may seem funny, but frankly, I think it's quite insulting to women. I never heard of what the man is talking about. And for women, this is not to be trivialized. It says also a lot about Santorum, who quickly backtracked and tried to dissociate himself with this man, calling him a jokester.
Remember Santorum for a minute, long an opponent of contraception. In an interview in 2006, then Senator Santorum said he's not a believer in birth control.
So would birth control be covered by that notion of freedom without responsibility? Look, I vote and have supported, birth control because it is not the taking of a human life. But, I'm not a believer in birth control. And as for artificial birth control, again, I think it goes down the line of being able to do whatever you want to do without having the responsibility that comes with that. And I don't think it breaks what I think. This is from a personal point of view. From a governmental point of view, I support Title 10, I guess it is, and have voted for contraception. And although I don't think it works, I think it's harmful to women. I think it's harmful to our society to have a society that says that sex outside of marriage is something that should be encouraged or tolerated, particularly among the young. And I think it has. We've seen very, very harmful long-term consequences to a society. So birth control to me enables that, and I don't think it's a healthy thing for our country.
That was then Senator Santorum, now running for president. Sandra Flukes, your response.
Well, I just want to clarify the misconception that the only women who are affected by this are young women who are not married. For the law students that I represent, the average age is 27, and many of them are married, and they have no access to contraception as well. But beyond that, I strongly believe that our government has to legislate for reality, not ideology. So if we don't provide contraception coverage and health care, that's not going to stop anyone from having sex, whether they should or should not be. And we really have to take care of women's health care and not worry about policing their moral choices.
We're going to leave it there. I thank you very much, Sandra Flukes, third-year law student at Georgetown University Law Center, past president of Georgetown Law Students for Reproductive Justice, not allowed to testify at the all-male panel on contraception hearing on Capitol Hill yesterday, and Congressmember Eleanor Holmes Norton. Thanks so much for being with us. This is Democracy